everybody. Joe DeMattos from HFAM here. Happy New Year, and thank you for all you're doing as we continue to fight the COVID-19 pandemic and as we begin to get those little vials of hope into the arms of Marylanders in need. We have rugged roads ahead, but we can begin to see the light at the end of the tunnel. Today, we're having an important conversation with two friends and colleagues. Bruce Yarwood, the former CEO of the American Healthcare Association and NCAL, and a CEO of a company that I've been tracking on probably for about 2 years now. They've been around for 6 years, a company called Voyce, and it's Andrew Royce of the company Voyce. Bruce, it's so great to see you, and I wish we could be visiting in person, but I'm glad we're both safe and sound right now.
Joe, it's great to see you. As you know, I'm one of your best fans, hugest fans. I think the job you do for the Maryland folks is fantastic. I wish I was still around a little bit. On the other hand, I look in the newspaper every day and say that's not a good thing. My retirement was, 10 years ago, and enjoying it now. Set on a few boards. Came into contact with Andrew, Royce of Voyce, a couple of years ago, and came through that from a fellow that I used to do business with, who was a chief of staff on Capitol Hill for a senator, and he has his own consulting firm, and he was representing Andrew. And he said, Andrew seems to have a product that might fit very well into the nursing home culture, and there's a lot of folks that need the translation service that they don't think about much, and I think under the regs it says you have to have it. And he had me come over to his office one day, and he says, "Here, watch this." He said, "What language would you like to speak?" I said, "Well, let's get some Swedish," because as you know, I'm married to a Swede. In the space of 2 minutes, he had someone on that I could see who could speak Swedish to me, and they can do that in over 200 languages. And I said, "Wow, this fits very well in terms of what could be in the nursing home industry." And so I had a chance to talk to you one day. We chatted some back and forth, and you said, "Let's try it." And so we've been going back and forth. In the meantime, I find that he's got something more than just translation service. It's what I call mini Zoom. And that is that you can take his, and he'll show you, you can take his product and link into a resident patient in the room, and he or she can pull up to, I believe, 9 different faces, so that you can do doctors, you can do nurses, you can do family, you can do all that sort of stuff. And so if people can't come in, they can at least get out and they can do something other than put their hand against the window to have some sort of interaction with their family. And so I thought it was a great idea. So I've been able to contact people like yourself and 2 or 3 other state execs, and we're trying to work our way through it in a couple different states to see if it works. And I think it will. And so I appreciate you giving us a chance to be in front of the people that you represent and see if there's something there that might work.
Well, thank you so much. Thank you so much, Bruce, for your kind words and your friendship, your mentorship, your support. Even though you've been retired now for 10 years, was important 10 years ago.
Yeah, thanks.
Was cherished when we celebrated it at the Greenbrier.
Oh, yeah. And, well, I remember.
And it's been good ever since, so I appreciate it. Now, Andrew, you and I started speaking a little over a year ago. I was impressed with Voyce relative to straight up automated, easy, secure, cost-effective translation services.
Right.
Because as you know, Andrew, Maryland has a very diverse population, just in general, and amongst our sector in skilled nursing and rehab centers and in assisted living. And depending on what part of the state you're focused on, that diversity is different, right? So the idea of having a number of languages that you can instantly translate on a device and a secure platform is intriguing. But the real reason why we were excited, and there was very little in the early days of COVID to get excited about, the reason why we were excited about amping up the conversations that we had with you, HFAM and Voyce, is because in the age of COVID, we're looking for every possible way we can to keep people safe from COVID-19 and possible exposure, but on the other hand, not isolated and connected. So it was your platform on that respect that really got us excited and caused us to enter into an agreement to get word out about Voyce to our members and to Marylanders. So Andrew, can you tell us a little bit about the road of Voyce and where you are today?
Sure. So just a little bit about the organization. We started well over 5 years ago. At the time, I was actually volunteering, working with immigrants who had fled civil war in Syria. And when you see these folks and their grandparents and little kids playing soccer, you really want to be able to help them in some way. And I realized that a lot of immigrants have language barriers. And while they want to learn English, it's not an easy language to learn. And when it comes to healthcare, describing your symptoms, getting diagnosis, treatment, taking medications, if you don't speak English well, things can get lost in translation. And so it poses a liability issue, a safety issue for healthcare providers, and really can actually hurt someone's level of care and patient care. And so this is an area where I felt passionately we can make a difference, but do it in a way that's still cost effective and it is an aid for all parties involved. And so we start on the translation side. We service 235 different languages, including some of the most popular languages in the state of Maryland. And as you mentioned, since COVID began, we realized that the application could be extended to have other services, including virtual visits, telehealth, the opportunity to do video visits between a provider and any patient, whether they speak English or whether they don't. And so that's been sort of the journey. Voyce services thousands of clinics and pharmacies, hospitals all across the US, Canada, the UK, United Kingdom. And the overall sentiment is this is improving patient care dramatically. It's doing it in a way that's very cost effective, and it's helping healthcare providers stay compliant with the state and federal civil rights legislation that guides the treatment of patients for patients who don't speak English or patients who are hearing impaired and need sign language services to be able to communicate their needs to providers. At the end of the day, we're just here to help. Whatever we can do to help, that's what we want to do. And as a result, we've been featured here on the cover of Newsweek, one of the top organizations in America helping during COVID, featured in places like Forbes and Cranes and others. And so we're trying to do good. And for the folks looking at this, watching this video, feel free to reach out and just have a conversation and see if this would be helpful to your facility. We always enjoy having great partnerships. So Joe, thank you so much for the opportunity to meet your members. And Bruce, thank you for being such a fantastic advisor to the organization over the years.
I appreciate you both, and thank you for that introduction, Andrew. I appreciate it. So obviously, member or non-member can reach out to me, Joe DeMattos at HFAM. You all have my contact information. Andrew, what information would you provide for people to reach out to you in terms of website and email address?
Sure. So our website is VoyceGlobal. So that's Voyce Global, Voice with a Y, .com. Feel free to message us through the website and we'll respond immediately. And again, just to have a conversation to see if we can be helpful, and whether it's from a compliance perspective, safety perspective, or having a significant need for these kind of services.
Hey, Andrew, I hate to put you on the spot, but if I make you co-host right now, can you show us Voyce like in action?
Yeah, I would be happy to.
All right, let me do that. All right, go for it.
Sure.
I just click the button.
So I have an iPad here. I'm going to start with the translation piece as if I were a nurse or a healthcare provider. I just voice command the application for the language. Spanish.
I am finding your interpreter now. Thank you for holding.
So you just voice command the application. The system will then route the request to our base of professional medical interpreters. One of them will receive the request, and hit the accept button, and then they'll come up on the video screen and introduce themselves to us.
So this is a person who speaks the language.
Ryan, and I will be your Spanish interpreter. My ID number is 1092015. How may I help you?
Hi, sir. How are you?
Hello, I'm doing well. How are you?
Good. I'm just doing a demonstration of the Voyce application for some of our colleagues and friends here. I wanted to pretend as if I were a healthcare provider and I'm communicating instructions to a patient who only speaks Spanish.
Thank you. I'm ready when you are.
I just want to tell the patient, and I'll begin now. Hi, this is Dr. Andrew. I will be providing a vaccination dose to you. This is the Pfizer, Pfizer vaccination.
Hola, este es el doctor Andrew y yo le voy a estar proveyendo una dosis de una vacuna a usted. Esta es la vacuna Pfizer, Pfizer.
Perfect. Interpreter, this is a demo, so thank you very much for your help today. We very much appreciate it.
You're welcome. Thank you so much for calling. Enjoy the rest of your day.
You too. Take care.
That's great. That's really great.
And we have
we're good.
For 235 different languages, as Bruce mentioned before, including Swedish.
Yeah.
I think you also said you might have native Hawaiian, but let me ask you a question. These are people that are available 24/7, speak the language, and have experience in medical terminology and transcription. Is that right?
Correct. So these are not just folks who are bilingual. They're actually professional medical interpreters qualified for the language interpretation of medical scenarios and medical situations, which again is compliant with the federal and state laws around civil rights and language access for patients whose English is not their primary language or preferred language of communication.
Pretty cool. Pretty cool. How would it look differently for a family virtual visit?
Sure. So if I were a patient and I wanted to contact maybe my healthcare provider or a family member or a friend, and I'm at the bedside, I would just hit the cross button right here. Just hit that cross button.
Uh-huh.
Screen would pop up to put in an address or contact information. For the sake of this demo, I'll just type in one of my colleagues' phone number and email. You just type in the phone number and email address, and the system will then route a request to that person. That person would then receive a notification of who's calling, first of all, and the opportunity to join that call via phone or via email. And you can add up to 9 different parties to join the call. So it's not just a one-on-one call or a 3-way call, but actually up to 9 different parties to join the call. And so you just route a request. I just typed in someone on my iPhone who I know, but then the system would route a call to them, and then they would accept and join the call to do a virtual visit. And again, you can add more and more people just like I just did before. So it just allows providers and patients and other family members to all stay connected during these challenging times when there's lack of visitation or there's a lack of in-person contact, where it can be very lonely for folks who aren't able to see their family members in person. So you'll see my colleague, his name is Terry. Terry just joined the call. Hey, Terry, how are you, sir?
I'm good. Muy bien. ¿Cómo está usted?
Good. We're just doing a demonstration of the virtual visits with some of our friends here in Maryland. And I just wanted to show how we can get a family member to join the virtual visit for folks who are bedside and can't have in-person contact. And you'll see on the screen here, there's a little gray button. And if I hit that gray button, I can just keep adding more folks to the party. So it's not just a one-on-one, but the opportunity to have a true party of people on the iPad at the same time to, again, keep the patients connected with their loved ones and with their providers of healthcare. So Terry, thank you for joining. We appreciate it.
Thank you so much.
Thank you
so much. Listen, that's incredible. Look, 2 things come to mind, maybe 3. So one, as a state exec, I deal with not just our assisted living and skilled nursing and rehab partners or government leaders, but one of the best parts of my job, one of the most important parts of my job during COVID, one of the toughest parts of my job is connecting with real people in Maryland with multiple family members who just want to be able to visit with their family members. They understand the need to isolate that person from the virus, but they're incredibly worried and anxious, rightfully so, in isolating in their engagement. And so this is huge because it's rare for someone, it's common for somebody in a nursing home or an assisted living to have more than one family member engaged. It's common in the care of a patient or a resident in our setting to have social workers, discharge planners, doctors, and nurse practitioners involved in their care. You know, and I hearken back to a personal story a few years ago when we got the call that my dad needed to go from the hospital to a nursing home for hospice care. And I remember I had to duck into a conference room at ACA because I was at Yarwood's place at the time, and I had to duck in to take the call. And, you know, there I am, listening on speakerphone, and my brother and sister in Hawaii were in Hawaii, and my sister who lived in another state was in another state. And, you were adding on, on different phones, different people to sort of conference in. It would have been so much better if we could all see each other and if it had been, video, right? I'll never forget that call. Now, of course, I got on an airplane and helped with that transfer, and I was there in like 2 days. But it would have been an easier call for me had we had something like this all those years ago, Bruce, what would you add before I ask Andrew a couple of final questions?
I don't know if I would add anything, Joe. I think that you've covered. I think he's covered it. I think the question becomes one of, is it in this COVID stuff that's going on now, and with the potentiality of vaccines coming out, is it too late to get involved with this? And I think the answer is no. Quite the contrary. Anything that makes it easier for people to get into, even though the buildings may start opening up, you know what? Great. So what? It's kind of like you were saying, you can use it in so many different ways. And I think at some point in time, you're going to want to talk price. But other than that, I think that you both are kind of laying out very well as to what it is, what the service is, and the significance of it.
Yeah, no, absolutely. I think I don't think it's too late. I think it's exactly the right timing.
Okay.
Both on the medical translation side and on the family visit side. If COVID has taught us anything, it has taught us the necessity of connection and finding new ways to connect. And that's changed for the future. It's sort of like telemedicine,
and how important it is.
Yeah, I mean,
you're right.
It had been struggling pre-COVID to gain traction. And now, that genie's out of the bottle. Telemedicine is part of the new normal. Now, it cannot replace in-person medicine, and in-person medicine and telemedicine will better integrate and augment each other going forward. So we will see an increase again in good old doctor's visits. But to say that we're going to end in the future telemedicine, that ship has sailed.
Yeah.
Telemedicine is now part of the tool chest. Andrew, what are like 3 things a hospital, an assisted living provider, a skilled nursing and rehab center, or even a family need to know about Voyce and what you offer?
Sure. Well, first of all, the service and the technology is HIPAA compliant. We are not recording any patient health information. We're not recording notes from the calls. It's just a conversation which the patient can consent to in their own language between a provider of services, healthcare services, the medical interpreter, and the patient. So it is HIPAA compliant, protective of patient health information. The technology is secure from point to point of connection. The second thing I would say is it's a mobile application. It's a technology application. The deployment is very simple. Setting up an account for the provider, downloading the app, which can take about a minute, and then with some basic remote training of the providers on how to use the application, similar to exactly how I just demonstrated. The deployment of the services is very quick and easy. And then I would say cost. This is extremely low cost. Very, very, very affordable for providers. The cost for the virtual visit, the little video visit, it's 1 penny per minute of use. So we're not talking about monthly subscription fees or annual membership fees or massive setup fees, just a penny per minute. If you use it, you pay a penny per minute. And similarly with the language interpretation, about 99 cents for the interpreters per minute. And the use is really, it's for those conversations that are important, especially for those critical conversations where a patient's getting medicine, they're getting diagnosed, they're getting treated, they're getting helped. It's a very, very important service and helps providers stay compliant with state and federal civil rights legislation. So those are the 3 things, Joe, that I wanted members to know. And again, just get in touch with us and I'll be happy to have a conversation, get to know you and see how we can be helpful.
Andrew, that's fantastic. And we really appreciate it. You've been written up in Forbes, Cranes, on the cover of Newsweek. You've scaled this business over the last 6 years to all over the United States, Mexico, and the United Kingdom. And look, we look forward to a positive future with you because we think that your app and this service can make a real difference in keeping people connected. So I want to thank you for making the time today. I want to thank Mr. Bruce Yarwood, my friend, mentor, and colleague. And on behalf of all of the members of our Health Facilities Association of Maryland, I'm Joe DeMattos, and I want to thank you all for the quality care you provide for Marylanders in need yesterday, today, and tomorrow. Be well, stay positive, test negative.